He was a bigger than life person and a super smart person. And it's funny because a couple of his colleagues have said he studied viruses. That's what he did. And a virus is what got him.
82-year-old Dr. Ilir Mul, Estonian-born, was a renowned conservationist and medical researcher for the U.S. Army who studied animals and disease. On March 20th, Walter Reed Medical Center referred the retired Army Lieutenant Colonel to the Potomac Valley Rehabilitation and Healthcare Center in Rockville for physical therapy in preparation for an upcoming medical procedure. The family would not be able to visit him there because of the pandemic, though his cell phone would be a lifeline. 7 weeks later, the man who studied viruses for the government would die from a novel one, while his family says they were deprived of basic communication with medical officials.
Why can't we mandate once a day, allow these patients in these nursing homes some kind of contact with a family member?
Dr. Mul's daughter, Pam Bennett of Westminster, a registered nurse, said communication was always challenging regarding updates on her father's care, especially as the number of COVID cases grew weekly at the facility. Once he contracted the virus, Bennett said she struggled to reach him, only spoke with him once while he battled it, and never had a chance to say goodbye. Given Bennett's training in hospice care, that was something she could not fathom.
The fact that he was alone, isolated, afraid, aware, and nobody would comfort him.
On behalf of her family, Bennett sent an email to Colonel Eric Allely, the National Guard surgeon leading the governor's task force on nursing homes. A strike team visited Potomac Rehab within a week of Bennett sending her letter. But we don't know if there was any correlation between that action and the concerns Bennett raised. According to the Maryland Department of Health, Potomac was one of 128 facilities visited by a strike team as of the end of May. In addition, according to the Maryland Department of Health's COVID-19 statistics, 30 residents there and 1 Potomac staff member have died as a result of the coronavirus.
The geriatric community is a community of people, and they have real feelings, and they lived a long life, and some of them have served our country, and they should not be forgotten.
Potomac would not answer our specific questions raised by Bennett about her father's care, citing HIPAA regulations. But in a statement they said, "We are communicating directly with the family regarding this private matter. While we are saddened by the terrible loss and impact created by the COVID-19 pandemic, we remain confident in the exceptional level of support and care all of our patients receive every day." The state ombudsman for long-term care, Stevan Ellis, told me that she urges Maryland families, if you are worried about the care of a loved one in a nursing home, to contact her directly at this number, 410-767-2161. And we will continue to monitor the issues facing nursing homes as many families remain unable to visit them.